Okay, so hello, thank you all for coming. Hope you had a nice lunch there. Anyway, welcome. My topic in this EPQ is to investigate how effective music therapy is as a form of treatment for adults diagnosed with unipolar depression. That is a long title, isn't it? There's so much topics to it. But first of all, let's start off. Who here likes music? Okay, cool. Who here knows what therapy is? Anyone heard of the term? Heard of it? Okay. I'll tell you about it. Anyway, before we begin, I'd like to start off by stating my aims and objectives. So I only have one main aim, which is to evaluate the effectiveness of music therapy. There are many types of therapies out there, and music is one of them. Using music in itself as a form to heal, regenerate, maintain, restore cognitive, social, environmental, and physical health of a person who may have unipolar depression. Now, unipolar depression is known as major depressive disorder, the most common type of depression in the world. And in the most simplest terms, major depressive disorder is a person characterized by an immense feeling of sadness, which could lead to loss of appetite, loss of any interest in or out stimulus or stimuli, and of course, feeling very low. My objectives is to find studies. I also have a primary research from a music therapist in Thailand called Kun Pim, who will be aiding through my insight in this topic. I've looked at the methods of music therapy from my primary research. I've reflected on the application to real life, how it applies out there from the therapy sessions, and of course to draw conclusions on how effective it really is. Why did I choose this topic? Now, you know me as I'm a music student. I also have a growing passion for psychology, an intimate one, because I would like to pursue this. I've always been fascinated by something that can help people out there in the real world, something not face value such as medicine, but something as an entity and long term, which music therapy can offer. Before we begin, a bit of psychology, a key chart here. Music therapy, as I said, is a form of treatment, an alternative, using musical methods and instrument, improvising, singing something as jingle bells to make people happy, and trying to identify triggers. What are triggers? Things that could make people become depressed. Now, if you're diagnosed with depression, you could essentially become triggered by something ordinary as seeing somebody cry, seeing a corpse, because it could relate to your past experiences or semantic memories that could trigger that depression, and you just go into it with many levels. Unipolar depression, as I said, is characterized in a person of an immense feeling of sadness. Active therapy is a type of music therapy, which means that the therapy involves activity and collaboration of both the therapist and the client. So they're actively involved, they talk, they play with each other, they explore the tone, color, and sound, and also about how it reflects on their own personal experiences. Receptive therapy is one side only. So the therapist can play a tune of Bach's Toccata and Fugue, and if this enraging tune brings a memory that maybe a person's father who used to traumatize them played this tune as a musician, it could come up and they could feel, oh yeah, this makes me feel sad. The therapist then works with that. Okay, tell me more about that, because they can't just figure it out like you're depressed. They have to find it using music. Individual client means a sort of weekly agreed coming in to sit down weekly sessions with the client and the therapist. Group therapy is more of an open, free, so you're in a hospital, there'll be like in the movies, like chairs, and you can sit down one by one, play some drum circles, make some rhythms, have some fun. Fly like this, doesn't it? Right, a topic sentence staff research is music therapy effective as a treatment for depression? Now, as I said, music can be used as a non-verbal and emotional, a standardized and cognitive way to identify triggers for depression. Now, with the mind facts of cued recall, which means something that could be triggering, something, it's like a cue, usually something you remember these past events, semantic memories that are linked with emotions that could impact on them, and the triggers, as I said. Now, one quick example of Kun Pim's client, we'll call him Client X for participant confidentiality, is that he came in and he spent a total of about 3 weeks not saying a word. Kun Pim couldn't reach him, right? Sorry, Kun Pim was offered from another therapist because the therapist couldn't reach him. So brought him to music therapy. Kun Pim then brought him a drum and he smacked it really loudly. He was very aggressive. And then Kun Pim, from that behavior, did a pre-pilot assessment, tried to find out ways into reaching into client X's aggression, which of course is later confirmed to be one of the causes of physical aggression of his mother when he was young, causing this depression. Music therapy can improve lifestyle and personality difficulties caused by mental illness. Music is proven to help emotional well-being and happiness. It's proven. In studies where individual music client is paired with standard care, which means ordinary analysis between therapist and client, pairing together, it's shown to be much more effective. Music can help a person with their reward, which means confidence, their stress and arousal, their fight or flight responses, their immunity, their body strength, and of course their social side, fitting into groups, feeling much more socially belonging to a community. Of course, depression has two main factors. State phase, which means the normal diagnosis, which means in the simplest terms, you're diagnosed with depression in the first term. Disease phase can go as far as being so sad you can't get out of bed and suicide. Anyway, there are the beauty and the dangers of music therapy also, which we have to take into account. Now, tinnitus is, in the simplest terms, ear damage. If there is too much irresponsible exposure of music to the client, it can cause ear damage. So that's biological, physical side. It's also healthier due to the psychological buildup of it. As I said, it's a spiritual healing kind of treatment. Social affiliation, isolation. If used too much, it can cause the feeling of distance. You've got to be careful in how you approach each client and their individual differences. There is confidence and belonging if used correctly in the society you're in. Suppressed emotions. Some people, they have so much suppressed emotions, if you release them with a trigger immediately, they can cry non-stop, and that can cause emotional and physical harm. Happier, easier lifestyle, helping with social, helping with emotional activities. Potentially cause stress, which can impact the brain, high intensity and pressure, but also music stimulates other parts of the brain, which is not normally used in real life, so that's good. One of the studies I've looked at is ERICLA, which looked at music therapy and applying it to normal kinds of therapy. What I found was that overall participants who received the music therapy alongside this improved better, showed great improvement in their overall life. And this is just some flaws and some strengths of the study, which one of them is that they used a model, which is a scale of Montgomery-Asperger Depression Scale, gives it much more reliability. Choi et al. Is based in Thailand. Effect of using music therapy on people with anxiety side, relationships and their problems. So they looked at different aspects of a person's life, and as expected, it improved all of them, ART, so that's good. Bad side of this is obviously because it's a pilot study, so it's a pre-study, it's not an actual one, there's not much insight. Good things about the music therapy in itself. The fact that it's open to all, it's not restricted to musicians. You don't have to be able to sing perfectly, you don't have to be perfect pitch, but you can enjoy music like Client X. He can express himself hitting the drums without even saying a word. Sometimes suppressed emotions can trigger that harm. You cry out so much because you suppress this feeling, this traumatic experience in which you might have faced when you were young, which could be the triggers or the root somehow to this depression. Tinnitus, as we spoke about, the ear damage, and obviously the use of meta-analysis, which is using many studies. Now this is bad because there's the file drawer effect, which is pretty much, in its simplest term, publication bias. People publishing studies that look good. Things that don't look good, oh, that never happened. Anyway, evaluation of methodology. So how I found this information. Now I have real insight in primary research with Kun Pim in a semi-structured interview over the phone. I asked about 8 questions, got more than I had, wrote a 5,000 report on that. Yes, semi-structured interview allowed for open questions. It's not closed, so we can weave into this, weave into that. It's also an open study criteria. The studies I looked at, Choi and ERICLA, were only a handful of all in my literature review. So by being open, it's not restricting to a limited pathway of data of having to be this and that. It's also considered that other mental illnesses or circumstances, it takes into other factors. And also the bad side of it is the fact that I've only got this from one therapist in Thailand. It's only one-sided biased. Moving on, the success of this EPQ. To me personally, I have got to appreciate and understand that music is much more than what I make. It's what I am. It's what I can give to others. Music is much more than you think it is. It's not just a tool for playing. It's a tool of communication and healing. Challenges and obstacles. Very difficult psychological terminology as an A2 student, nevertheless. Very difficult to find the correlations of lots of tables and tallies. There's also title decisions. I've changed so much. I've changed from in Thailand to elder's age to in America, name it. Until now, the one I have. We'll get back to that later. Anyway, I have primary research. That's insightful. I also have been visualizing the process, and choosing the study age group was a hard one. Middle-aged adults, solely because most of the data that I had, it was on middle-aged adults. That's why. Knowledge milestones. What did I learn from this process? I learned how therapy worked. How did it work? I also learned to effectively assess and evaluate a study. Right? This is a good thing when you're doing doctorates or in the future. I've learned the creative processes, each model into approaching therapy, which is not in the realm of this presentation, but on my report. I've also looked how the therapy physically works. Also about each studies and the factors that make up depression / the factors that can heal a person. Finally, it's a nice thing to prepare for money. Who knows? Career. Nevertheless, as my conclusion, referring back to my aim, I can say to an extent, music therapy is effective to treat people with unipolar depression in a middle-aged age range, but much more superior if combined with standard care. Fire away.
Any questions?
Richie, that was awesome, thank you. I learned a lot there, and I've read your report and I still learned even more there. Fantastically engaging, I think we all enjoyed that. Can I ask you a couple of things to start off with? One of which is, if someone was doing a project similar to this, not necessarily identical to, but similar to this, perhaps looking at the effectiveness of a particular form of therapy within a certain population, based on what you've learned from doing this project, what advice would you give that person?
Okay, so if they're looking at a form of therapy for depression?
Well, it could be for anything. Let's say depression.
Okay, well, first of all, they should understand what depression is, or whatever they're looking at. Grasping around the sides of it in society, but also in individuals and people around them. You have to have an intimate pursuing of this topic because there's a lot of studies on it. You also have to look at different types of therapy, how many types there are within it, and the good things and bad things in each application. You've also got to try to look at the unpublished, if you can, or doctorate dissertations. The file drawer effect publishes that didn't get published because they have bad results. But most of all, you should, if you can, consult a professional. Because they know everything. Miss Safira here got me in contact with Kun Pim, and she gave me a much more broader knowledge. So what would you do is, you'd get a professional, you'd have, what's that word? Compassion into doing this topic.
Okay, thank you.
Since I was there with you when you spoke to Kun Pim, has it ever occurred to you to actually go into a music therapy session? And then what type of constraints would you think the challenges that you would perceive going into one?
I'm a very personal person. I didn't hear. Anyway, if I go into a session, right? Let's say an individual, I would feel like I'm intruding that person's space. It would feel, intimate to them. But also, I would say, to go into a therapy session, yeah, that's quite interesting. I'd like to try that. I'd like to see it in live action, practically, not theoretically. Challenges would be a bit, comfortable. It's the first time you're in between two people, but also this amazing experience of how the therapist tries to work through to the person using various musical techniques, instruments.
And maybe follow up to this. How much has that title changed from right at the beginning, if at all? Good. Can you take me through that journey of what the first one looked like, what happened, what changed it, how did it change?
I can't remember them all. All 9. First of all, I looked at music therapy as a form of treatment for depression. That's too broad, isn't it? Then I looked at music therapy as a form of diagnosis, not treatment, diagnosis with people with bipolar depression. Yeah. And then I went back to treatment because diagnosis, you don't get a lot from that. Treatment is more of therapy. I'm interested in the realm of the therapy, what happens in there. So then I looked into the music therapy's treatment for children. I'm interested in young children, teenagers, because my stats figured out that there's an increasing growth of people who listen to music these days. But a study found that 9% of the sample who listen to music develop depression, so that's a bad thing too. Then there was very little data on that. Then I looked at adults, generally 50, and then there was only 2 data on that. So I looked at middle-aged adults, I should include that in there, 30 to about 40 years old, because the data had lent itself to it. It was available, it was free, and it was full length. And then I went with unipolar depression, going further in it, but I also thought severe unipolar depression to capture also the essence of the disease phase that I briefly talked about. It's been a heck of a journey.
Do you have any data on whether music therapy is effective for bipolar depression as well? And if so, is there a reason why you choose unipolar over bipolar?
Thinking about it.
Someone asked, what is the difference? Should we explain that first?
Okay, I'll be very honest with you. I forgot what bipolar depression means. It has been a long time, but I can answer you if you refer back to me after Thursday, because I have my psychology exam Thursday. The next topic in Psych A2 will be about depression. I have to get back to you on that. Unipolar depression, on the other hand, it's major depressive disorder. Like I said, the main characteristics of it is feeling a very low level of sadness. You have from state, which is feeling sadness. If we compare OCD, let's say state, OCD means obsessive compulsive disorder. It's not being neat, it's doing something in a way. If I have state OCD, it's, oh look, that's not straight, here we go. If I have severe OCD, that means I have to turn off the lights in every room I go to 32 times exactly. Always do this when I go into my house 14 times exactly, otherwise that's